Hello and welcome. Today, we're diving into the DSM-5-TR, the latest revision of the Diagnostic and Statistical Manual of Mental Disorders. Whether you're a clinician, researcher, or simply curious about advancements in mental health, this video will walk you through the most important updates in the DSM-5-TR and what they mean for differential diagnosis. Let's get started. Let's begin with a major highlight: the addition of prolonged grief disorder. This new diagnosis addresses a profound need in mental health care. Prolonged grief disorder describes individuals who experience intense disruptive grief that persists for over 12 months for adults or 6 months for children. Symptoms include yearning for the deceased, emotional numbness, or even disbelief. Here's an example. Imagine Maria, a 48-year-old woman who lost her husband 2 years ago. Despite the passage of time, she still struggles with daily functioning, avoids reminders of him, and finds it difficult to accept his death. Initially, she was misdiagnosed with major depressive disorder, but her clinician revisited the DSM-5-TR and identified prolonged grief disorder. This distinction made all the difference. It allowed Maria to receive targeted, grief-focused therapy that helped her find healing. Another exciting improvement in the DSM-5-TR is its focus on cultural and linguistic inclusivity. Now, culturally specific expressions of distress, like the Latin American concept of ataque de nervios, are explicitly recognized. This helps clinicians avoid pathologizing normal cultural behaviors and strengthens the diagnostic process for patients from diverse backgrounds. Here's an example. Take social anxiety disorder. In some cultures, avoiding eye contact is a sign of respect rather than anxiety. By incorporating cultural context, the DSM-5-TR ensures clinicians can make accurate, nuanced diagnoses. Another critical update is the DSM-5-TR's expansion of differential diagnosis guidance. This revision gives clinicians clearer tools to differentiate between disorders with overlapping symptoms. Let me give you a couple of examples. First, let's look at attention deficit/hyperactivity disorder, or ADHD, versus specific learning disorder. Both can present with difficulties in school, but ADHD affects attention across multiple settings, while specific learning disorder focuses on academic skills like reading or math. Identifying this difference can steer treatment in the right direction, or consider bipolar disorder and borderline personality disorder. Both involve mood instability, but the DSM-5-TR emphasizes that bipolar disorder includes distinct, lasting episodes of mania or depression, whereas borderline personality disorder features rapid situational mood changes, often linked to interpersonal stress. The DSM-5-TR also tackles another important issue: addressing systemic biases in mental health diagnosis. Historically, disorders like schizophrenia have been overdiagnosed in marginalized populations. This revision acknowledges such biases and emphasizes the role of cultural and contextual factors in diagnosis. For instance, symptoms of paranoia in post-traumatic stress disorder, PTSD, may appear similar to psychosis but are often rooted in trauma. With the DSM-5-TR, clinicians are better equipped to differentiate PTSD from schizophrenia, avoiding harmful misdiagnoses. And of course, the DSM-5-TR integrates updated prevalence data and insights from recent research. For example, it reflects an increasing awareness of autism spectrum disorder presentations in women and individuals without intellectual impairments. This helps clinicians capture the full diversity of ASD presentations. Another example is substance use disorders, where the DSM-5-TR emphasizes the neurobiological underpinnings of addiction, reinforcing its chronic nature. This perspective is crucial for reducing stigma and guiding effective treatment. So, let's summarize. The DSM-5-TR offers valuable improvements for clinicians and patients alike. By adding new diagnoses like prolonged grief disorder, refining cultural sensitivity, expanding differential diagnosis tools, and updating research data, the DSM-5-TR bridges the gap between clinical practice and the complexities of human behavior. Whether you're navigating overlapping symptoms, considering cultural factors, or addressing systemic biases, the DSM-5-TR equips you with the knowledge to make accurate, compassionate diagnoses. Thank you for joining me in exploring the DSM-5-TR. If you found this video helpful, please like, share, and subscribe for more content on psychology and mental health. And don't forget to leave your thoughts or questions in the comments below. Until next time, take care and keep learning.